Good afternoon, everyone, and thank you for joining today's Partner Solutions session titled What Business Owners Need to Know to Reopen Safely. Before we get started, a few housekeeping items. This is an express session lasting 20 minutes with 5 to 10 minutes of transition time to allow you to get to the next track of sessions that will begin at 2:30. All attendees today will be muted throughout the session. Please use the chat if you have questions or comments for our speakers. We will use the last 5 minutes for question and answer, and we'll take as many questions from the chat that we can. The session is being recorded and it will be available tomorrow on the event site. So please feel free to share with your colleagues or those who may not be able to attend. Now I will hand things over to Andrew Kobolinski, CEO of Primary Health, and Eli Velasquez, consultant of N95, to get today's presentation started.
Awesome. Thank you, Kate, and welcome everybody to this Partner Solutions session. We're going to be talking a little bit about, not only how to get back to work, but how to stay at work utilizing COVID testing and where testing fits today, having seen the ups and downs of where all that has gone through. But I want to start with a little bit of background on who we are, why we're here. Again, my name is Eli Velasquez, and I served as a consultant to the NIH RADx initiative. That was a $1.5 billion initiative by the NIH to get COVID diagnostic tests into the market as quickly as possible. And through that initiative, we linked up with various partners like Project N95, like Primary.Health, and a whole slew of other test providers that you may have seen in the market today, whether it's the CVS shelf all the way down over to the advanced labs. And so our whole focus was really on trying to get those tests into the hands of the organizations, the communities, and the employers that needed them as quickly as possible. So we have insight into what that looked like then, what it's looking like today, and what we think it looks like in the future. And so again, I want to introduce Andrew Kobolinski, CEO of Primary.Health, and we're going to engage in a quick discussion of what we saw early on. And he provides that boots on the ground experience of having seen and built this initiative in this company to provide solutions for these ecosystems and these employers. So Andrew, I'd love for you to introduce yourself, tell us a little bit about Primary Health, and then we'll dive into the discussion.
Hi everyone, this is Andrew Kobolinski, CEO of Primary Health. We're an interesting company in that we were started in the pandemic. We were basically born out of necessity to enable testing in several communities. Our projects began in Bolinas, California, and San Francisco, California, with a study in partnership with the University of California, San Francisco in the San Francisco Mission District. And that project, in the early days when we were still just a volunteer group, taught us about asymptomatic transmission in the country. And it really opened everyone's eyes. At that point, testing was only available to symptomatic individuals. And with the data from that UCSF study, 55% of us were walking around very contagious and spreading it and positive, not knowing it. And that's what kind of carries through to today. We have a Delta variant, we have similar paths of transmission, and Primary, well, we'll get into the questions answered, but we've been a company very much born out of the pandemic, servicing the needs of the pandemic, bringing testing and vaccine work to communities, employers, and workplaces, keeping essential workplaces open when we had lots of lockdowns. And we've learned a lot through this chapter. So back to you, Eli.
Thank you, Andrew. So I want to dive into that specific. We learned a lot. I know that from our experience working with a lot of employers and organizations at the beginning, there was a lot of misinformation, or there was a misunderstanding of where to go, what to do, how to start. And I want to focus on what you saw, some cases where it actually worked, where people tried to get these things going. Can you give us an example of some organizations that figured this out early?
Yeah, so one interesting area, aerospace, advanced kind of composite aerospace manufacturing. We're talking about an industry where if you shut down that plant, you might delay a production line that's worth billions of dollars by years. And you also have a very kind of essential workforce to kind of everything is very timely. It has to be scheduled. There's certain plans, commitments, contracts. So that's one industry. And then another market that was really interesting is film production industry as well.
That's right.
Very scheduled, you have to do this work years in advance, often between these, films and TV shows going out and hitting our Netflix channels and things like that. And basically, for these employers, shutting down during the pandemic really was an option. So they were some of the first to just jump in with full scale, very expensive testing programs that cost several $100s a test every day at times. Really quite astonishing, the amount of kind of commitment to these programs well before public health agencies and the federal government stepped in. And why were they doing it? Well, just the health of their employees. If they have an outbreak and they had to shut down or slow down production, it would destroy their timeline. And with very aggressive testing, they're able to isolate individuals and community spread that's impacting their group and isolate those individuals, get them off the work site, keep spread from happening, and keep the core crew running the production line, et cetera. And what we saw in one of our aerospace manufacturing with several hundred employees that were going to work every day through the course of the pandemic, they had 15 positives, but they're able to actually catch them and stem any community transmission within the workplace. So that was a huge success on their part, where the relative inputs were only 15 over the course of the pandemic, but it didn't cause an outbreak or a spreader event of hundreds. And for them, that was a huge win. And today, with their testing program, they're down to using the $10 Abbott rapid antigen cards, which is really cost effective. And they're able to run that in OTC manner, which doesn't require medical supervision. So where the program used to cost hundreds of dollars a test, now it costs a small fraction of that. It gives you one example, Eli, of kind of an effective program that actually kept an industry online.
Yeah, absolutely. And we saw various cases of other industries. And one of the things that Project N95, which is a nonprofit that also was birthed through through the pandemic as a means to provide PPP out into the ecosystem, we then partnered with Project N95 to help build a online marketplace for tests. And so we put that thing together to enable employers to go find solutions, to go find resources, whether it's PPP, whether it's tests, whether it's other resources that they need. It became a pretty as comprehensive solution set as we could possibly make it. Now, one of the things that we are consistently hearing is, that's great, guys. We need a test in the beginning, and we maybe got them, maybe we didn't get them, but we got the vaccine now, so we're good. We can open work. We're bringing people back, and so we don't really need to invest in testing. We don't need to worry about testing. It kind of sits over here in this other frame of mind. I mean, I would love to get your input and your opinion, Andrew, on, does it still matter? Should we still care about it? And if so, where does that fit into these mitigation protocols for COVID?
Yeah, here's why it matters. I think most of us are going to have a personal story of someone we know that's been impacted by COVID. I lost a father-in-law in February to this. A week before he was scheduled for his Pfizer vaccine, so it just wasn't in time. It matters because that story will continue and is going to continue through the fall into the Christmas time period. What's different about it now, why people aren't panicking and why it's really hard to sway public opinion, is that it's a slow burn. Before we had this spike, a lot of death, it was scary because we didn't know how high it would go. Now we have this increase and this persistence that we can all kind of feel like, oh, this is normal, when it's not. And over time, that's 30, 40, 50,000 more deaths. And those are people we know. Those are our family members. Those are children with long-term issues after this. And what's also more insidious about the Delta variant right now is that we still lack some data about its transmission amongst populations. And to give you an idea of some of the simple math, we can't vaccinate our kids yet, under 12. So you have a group of kids going back to school, full capacity without protections. And guess what? The kiddos, for the large part, are going to be fine. They might get the virus, they're going to get a little sick, and everyone's going to be, oh, no big deal. The schools are not super incentivized to have aggressive testing programs. But what happens is, and on average across our country, the unvaccinated rate in our households meaning other children in the household and immunocompromised and people declining the vaccine, still means 4 out of 10 at home on average are going to be impacted by outbreaks in schools. So one classroom of 20, that yields another 8 to 20 at home that are infected. And then of that population might bring it to a workplace, might bring it to another classroom, and it continues. And it continues kind of slowly. It's not an exponential growth, but it continues almost in the most insidious way of finding every last vulnerable person in our population. So why does testing matter? I think we've all lived in workplaces where we've had a colleague or someone who kind of flaunts the rules and kind of says, "Oh, it's fine," and but we don't actually understand that our peers have vulnerable members of their household, and you can have employees that go about and are very cavalier that they're fine and their kids are fine and they got it and they're strong and all this kind of things. But at the same time, there's a lot of our peers who have family members who are vulnerable. And that behavior will lead to transmission to them. And it'll happen very slowly. It'll happen one by one. It won't be a bunch in a week. It'll be a couple that you may know about through your workplace in a month, and it'll continue. And what's sad about it is it's completely preventable. Our vaccinated staff, it's going to be hard with our current regulatory environment to get a clear understanding of who on staff is actually vaccinated and who is not. We're not doing passport type things. So what this comes down to is if you have vulnerable family members at home, you want to quietly in an environment, whether it's pro-vaccine or anti-vaccine, you want to have tools to be able to take home with you and protect your family, because you're going to a fundamentally unsafe environment where transmission is potential. And if you have a vulnerable elderly parent, if you have an immunocompromised, someone's going through cancer treatment in your household, you're going to want that testing just to have peace of mind that you're not infecting your family. And
Yep.
as employers, as kind of employers in this country, we have a responsibility to safe workplaces and keeping our employees safe and their families safe. Making free testing available for them, for those of us who feel concerned or try to protect something, making that available is, I believe, our obligation going forward.
Yeah, absolutely. And I would add to that, answering the question in the chat is, any specific messages that businesses should invest in testing now and how to sell the idea. It's a strategic decision, right, for maintaining safety at work. It's a post-pandemic preparedness. It's enabling you to not only get back to work, but stay at work. We still have a lot of we don't understand a lot about the Delta variant, and there's a lot other variants that are being studied right now with the NIH RADx program. And so there's a lot of unknowns still. And so, testing has also become more readily available. It's a lot more inexpensive. So the excuses to why not to do it as far as the logistics are concerned, those have come down. It really comes down to being a good business person, and making a strategic decision to say, look, if this thing changes on me, which we know it possibly could, I'll be ready. My competitor may not be ready, and so I want to be proactive in taking that approach to that. So that's definitely something that we've seen coming online. Now, when it comes to implementing a testing program, Andrew, what should employers be thinking about? What are some of the 2 or 3 things that they should think about and starting to set one up? And is there one that's better over another? How should I begin that process?
So if you have been doing a testing program, the world is wonderful for you right now. Testing is very commoditized. There are a lot of options. You can lower the cost of your program. You can change the frequency. You have tons of options. If you've never done a testing program, it's amazing time to do it. You can order really great tests. For example, on Project N95, there's this quick, rapid PCR from Lucira. It's an instant one, just as good as in a lab. And it's, little device, and you can just literally have a sample and employees can go do it themselves. And the pain and difficulty has been taken away finally. A year ago, you had to find a medical provider. It was painful. There was a lot of hassle, HR issues, unknown questions. Today, you can literally just go to CVS, order some tests, go to Project N95, order some tests, put it in your cafeteria at the workplace. Say, hey, it's free to employees if you want to use it. If that's as simple of a program you want to go, and you never have to think about it, never even track it, it's that simple. If you want to get a little bit more advanced and manage and test all visitors to a work site and get a little bit more prescriptive about how frequently people are testing, then software like primary.health help you manage that process, but we also make it super simple. The point at the end of the day is, don't be afraid. There's no bad option right now. Just try something.
Yeah, I think that's important. We face that a lot, where we just found employers were just not figuring out how to do this. And there, you know, you can go to the Project N95 site. There's lots of resources there. You can go to primary.health and they start redirecting you to the right people as well. And ultimately, there is really no excuse to say I don't want to run a test, other than you don't want to do it. And so those are definitely some key considerations to keep in mind. For certain industries, Andrew, are there certain industries where you say, you know what, maybe that's not really going to be important? Should this be implemented across the board? Should some just say, look, this I've already switched over to a more remote situation, so it really doesn't fit for me? Like, how should they think about, you know, the changes in the workplace as well?
Think of it as a benefit, like we put coffee in our cafeteria for employees. Testing is going to be the new normal. I think we've all had a collective kind of realization, if you have children and they come home every other week with a new illness, this idea that that's normal and that we can just kind of go about our lives with people being symptomatic is going out the window. Employees really want to have a safe workplace. And so as we look at this going forward, you want to bring testing in with COVID and use that as an excuse to make it normal in the workplace. So one day when you have a rapid OTC flu test, if you have rapid tests for RSV or other communicable diseases that might be impacting your workplace and impacting employer productivity, those kinds of tests can just be put in the cafeteria right next to the other tests, and it becomes normal part of life. And overall, your employees, it is the new normal. So you want to consider it that way and use COVID as an opportunity to bring that into the workplace and get people comfortable with these programs, because I think this will only get more important in the years to come, and public health will find new ways to make that more of a requirement upon us.
Yeah, our infectious disease experts always recommend vaccines and testing. That's the best way to, prevent and control disease, especially a pandemic. And any final words, Andrew, for our audience, and then I'll turn it over to our hosts here for the final word.
Yeah, these numbers are real. 4,000 people in the ICU, 14,000 in the hospital right now, and that's just going to increase slowly, and it's to be persistent for a long time. Delta and these new variants are really frightening. The best way to kind of mitigate this, and it's funny, in our work site here, we probably have a 95% vaccination rate, and we supply, just self-administered OTC test kits, and the numbers that are taken and used is quite high. I mean, even amongst vaccinated, the idea of, hey, I have the sniffles, I want to test, am I a breakthrough case? People are worried right now. So I think it's our obligation to just do something to put the kits out there and make that available to employees. So get started. If you only want to spend $200 on it, you can get a lot of test kits for $200. So go ahead and place that order and just get something started so you can iterate upon it each week, each month, and meet your employees kind of where their demand is. And even if they're vocal right now, it's quite astonishing if you just put it out, how many will actually take it and do it.
Awesome, Andrew. Thanks so much. Super great insights. And I want to thank you and for your time, and I want to thank ACCE for hosting us. So with that, I'll turn it back over to you, Kate.
All right. Thank you, Andrew and Eli, both for sharing your time, experience, and expertise with all of us today. Also, thank you to our attendees for joining us for this session. As mentioned before, our session was recorded and is available on the site, the event site tomorrow. And I highly encourage you to visit N95's virtual booth and profile page for more information. A reminder that our next partner solution track begins today at 2 p.m. And with that, I will let Eli have a quick word to finalize and close out today's session.
Awesome. Thank you, Kate. By all means, please do visit the Project N95 website. Visit primary.health's website, get all the information and resources that you need. Reach out to us if you have questions. And by all means, enjoy the conference. And thanks again to ACCE for hosting us.